Hey, my name is Emily Gingrey, and I chose von Willebrand disease as my genetic disease to research. I'm just going to tell you guys a little bit about it. Von Willebrand disease is a genetic bleeding disorder, and it's actually the most common bleeding disorder among men and women. Approximately 1 in every 100 people in the United States have this disease. We have a von Willebrand factor in our blood. It's a protein, and it acts like a glue when it binds with our platelets to help form blood clots. If someone has a decreased amount of this von Willebrand factor, or their factor isn't working the right way, these both will lead to increased bleeding times. Von Willebrand disease may be inherited from the mother or the father, either autosomal dominant or autosomal recessive. In autosomal dominance, each child has a 50% chance of inheriting the disease from either their mother or their father if they have von Willebrand disease. Autosomal recessive, if both parents have the gene but not the disease, then there is a 25% chance the child will get the gene from both parents and the disease. There's also a 25% chance the child will not get the gene and cannot pass along to their children. However, there's a 50% chance the child will get the gene from either parent. The child will not have the disease but can pass to their children. I have included a link from the CDC about the genetics and the inheritance of von Willebrand disease.
Hi everyone, my name is Emily Gingrey, and I chose the von Willebrand disease as my genetic disorder to research.
If your patient is coming in and
a little bit about von Willebrand disease. It is a genetic bleeding disorder. It is actually the most common bleeding disorder among men and women. It's approximated that 1 in every 100 people in the United States have this disease. And what it is von Willebrand is a factor in our blood. It's a protein, and it's in our blood, and it works like a glue when it binds with our platelets in our blood. And this works to decrease any bleeding time. If someone has von Willebrand disease, then they have a decreased amount of von Willebrand factor, or the factor they do have doesn't work properly, and this will lead to an increase in bleeding time.
Any type of miscarriage.
Von Willebrand can be inherited from the mother or the father, either autosomal dominant or autosomal recessive. If dominant, each child has a 50% chance of inheriting it from either the mother or the father if they have von Willebrand disease. When autosomal recessive, if both parents have the gene but not the disease, there is a 25% chance the child will get the gene from both parents and the disease. There is a 25% chance the child will not get the gene and cannot pass along to their children. However, there's a 50% chance the child will get the gene from either parent. The child will not have the disease, but they can pass it on to their children. I've included a link right here from the CDC for more information on inheriting and genetics of von Willebrand disease. So some of the signs of von Willebrand disease, nosebleeds. It is stated that someone who has spontaneous nosebleeds, more than 5 a year, and they last longer than 10 minutes. Bruising with no or little trauma or injury. The bruises can be larger than a quarter in size, and they usually are not flat. They can have like a bump, like a hematoma. And these can occur if this occurs more than 4 times a month. Longer bleeding times when someone has any type of dental work, bleeding gums, any type of surgery, and childbirth or miscarriage. women are especially women are at an increased risk because of the heavy, if they have a heavy menstrual period. If they're having to change a tampon or a pad every hour, their menstrual flow is lasting longer than 7 days. Passing large blood clots, usually larger than a quarter in size.
On physical exam, the patients will come in and it will be normal except for the bruising and the hematomas that they have. Screening tests, the CBCs will be normal except for the hemoglobin and the red blood cells that will be low, showing anemia. If when you take a PT and an APTT, both of these values will be low. And if that is the case, then you can order a fibrogen test if the PT or APTT are abnormal. Specific diagnostic test, factor VIII, von Willebrand antigen, Risticin cofactor, von Willebrand factor multimers, and platelet aggregation tests. These will usually be performed by a hematologist. Treatments for von Willebrand disease, there are several that work to release more von Willebrand factor in your blood, and that's the desmopressin acetate injection and the desmopressin nasal spray. Both of those are normally used for milder forms of von Willebrand disease. There's also recumbent VW factor, and it's injected into the veins just as a replacement therapy. Antifibrinolytic drugs that are going to help prevent the breakdown of blood clots, and also birth control pills that work to increase the levels of von Willebrand factor and factor VIII in the blood, and also reduces menstrual blood flow. Clinical practice guidelines for diagnosis and treatment. If you have a patient who comes in and maybe they're complaining of, they think that they bruise easily, but they don't have, they don't know if either one of their parents have von Willebrand disease. The guidelines recommend clinicians use a blood assessment tool for further screening to see if they need to do further screening. However, if you have a patient who comes in and they have a high probability of having von Willebrand disease, maybe they know of one of their parents who had it or someone in their family, and they're complaining of the easy bruising, the increased bleeding times, then the guidelines recommend not you having to use a blood assessment tool and just go straight into other testing and or referring to a hematologist. I added a link for other guidelines as well, for treatment guidelines.
Hi everyone, my name is Emily Pingree, and I chose von Willebrand disease as my genetic
a few points
disease
about
to research.
Von Willebrand disease.
Von Willebrand disease is a genetic blood disorder. It's actually the most common bleeding disorder among men and women. Approximately 1 in every 100 people in the United States have this disease. And what it is von Willebrand factor is a protein in our blood, and it works like a glue that binds with platelets to help form clots to decrease our bleeding time. If someone has von Willebrand disease, then they either have a decreased amount of von Willebrand factor, or their von Willebrand factor is not working the way that it should, and both of these will lead to increased bleeding times. Genetically, it can be inherited from the mother or the father, either autosomal dominant or autosomal recessive. If autosomal dominant, each child will have a 50% chance of inheriting von Willebrand from the mother or the father if they have the disease. If autosomal recessive, if both parents have the gene but not the disease, there is a 25% chance the child will get the gene from both parents and the disease. There's a 25% chance the child will not get the gene and cannot pass along to their children. However, there's a 50% chance the child will get the gene from either parent. Child will not have the disease but can pass to their own children. I provided a link from the CDC that gives more information on the genetics and the inheritance. The signs of von Willebrand disease. In clinical practice, you may see someone who experiences nosebleeds, spontaneous nosebleeds that last longer than 10 minutes, are hard to stop. These usually occur more than 5 times a year. These patients will also have bruises and hematomas. They'll probably complain that they bruise very easily with no trauma or injury. Usually these bruises are larger than a quarter, and they notice them more than 4 times a month. They also will have longer bleeding times after any type of dental work or surgery, childbirth, miscarriage, and women will complain about having a heavy menstrual period, having to change out their tampon or pad every hour, menstrual flows lasting longer than 7 days, and passing large blood clots. The physical exam with these patients will be normal except for the bruises that you will see in the hematomas. The bruises will not all be flat, they'll be raised as in a hematoma. Screening tests, the CBC will be normal except the hemoglobin will be low and the red blood cells will be low, so they'll be anemic. The PT, if you get a PT, which you should, and an APTT, these values will be low. And if either the PT or APTT is low, then you can order a fibrogen test. And then, of course, you would want to send to hematology. Specific diagnostic tests would be a factor VIII, a von Willebrand antigen test, resostatin cofactor, von Willebrand factor multimers, and platelet aggregation tests. These will be usually done by a hematologist. Treatments for von Willebrand disease, it really depends on the severity of the disease. If the bleeding is mild and doesn't cause any problems, they may not treat it at all. Some other medications that are used to treat are desmopressin acetate injection and desmopressin nasal spray, and these both work to release more of the von Willebrand factor in the blood. Recombinant von Willebrand factor can also be injected into the veins to replace it. Antifibrinolytic drugs that will help prevent the breakdown of blood clots, and also birth control pills that work to increase the levels of von Willebrand factor and factor VIII, and of course also reduces menstrual blood flow. I've included some clinical practice guidelines for diagnosis and treatment. You can find them, the link that I have provided right here. If a patient comes into your clinic and they have a low probability of von Willebrand disease, it is recommended that the clinicians use a blood assessment tool for further screening. And for patients who come in and have a higher probability of having von Willebrand disease, maybe they have a parent, maybe they have all of these signs, the guidelines recommend not using a BAT because it's not warranted, and just going straight into the other PT, APTT, and fibrogen tests, or maybe send to hematology. And these are my references. I hope that you guys got a quick takeaway from von Willebrand disease. One, that it's the most common bleeding disorder, some signs of the disease, and how you would diagnose and treat it. Thanks so much. Bye.